Good afternoon, Dr. Candace. How are you today?
I am awesome, awesome, awesome. And it is good morning here. I'm feeling good. Good afternoon where you are. I am
Yes,
feeling great today. I feel good. All these Fridays I've been feeling good. How are you feeling?
I'm feeling good. Happy Good Friday,
I
Resurrection
know.
Friday.
Yes, it's Good Friday. Maybe that's why I'm feeling good. No pun intended. It's Good
Mhm.
Friday.
Yeah, yeah. I look, feel good Friday, feel good Friday on a good
Yeah,
Friday.
that's right. That's right. I am feeling good. How has your week been? Because it's Friday. So how did it start? From Monday to now, how you been?
I've been okay. I've been okay. I had a pretty good week. Nothing to complain about. How about yourself?
It's been good. My week, Tuesday, Wednesday, and Thursday was heavy. It was heavy with patients and clients, and Monday was heavy. So I had a heavy week, but I got through it, and it was good. So it was a heavy work week. So I'm glad that today I'm able to decompress. But it was a good week. I will say about the weather out here, because everybody that's watching, thank you for watching as well. I'm here in sunny California, and it's a little chilly this morning. I
Mm.
think meteorologists on the news lied. They said it was going to be 78, 80 degrees, and it's a little chilly. It is. It's a little chilly, so I'm not liking that. But other than that, I'm okay. How's the weather where you are?
Surprisingly, it's nice out today. It's pretty warm. Girl, yesterday it got up to 81 degrees for the past, like, I think yesterday and the day before that. And it was just like, whoa. We had some storms last night, but other than that, it was good.
That's good. That's
Mhm.
good. I'm loving that. I'm loving that. Why? Because good weather make you feel good. So
Yes.
and you know this. You a psych woman. You got this. You know this. T. Do you think good weather make us feel better?
You know what? I'm gonna say 100% yes. Because at the end of the day, it's just like when you see the sunshine, who can't smile when they see the sun?
I know.
It's like when we're outside, when it's gloomy, you feel the gloom. You know what I mean? Like we know this is all a part of seasonal depression. You know
Yes.
what I mean? That comes up, that topic always comes up when you think about, the seasons changing and how we feel and whether we're up or whether we're down and things like that. But
That's
oh my
true.
goodness, I think it's, yeah, the weather does play a good role when it's warm outside, when sun is out, birds are chirping. I think it plays a really good role. Yes. How about you? What are
I
your thoughts on that?
I totally agree. I totally agree with that. With me, when it's nice outside, our mood change. It raises our serotonin levels, and we're at a good place. I definitely believe that.
Mhm.
However, I've seen another side as well.
Mhm.
When it's good outside and the weather is good, do you think crime and some of the don't want to use the word crazies because we therapists, but do you think crime and the unpredictable and kind of the madness comes out when it's hotter? Or do you think when it's cold outside, people are like, I'm going to stay in. I'm not going to be as rough.
You know what I'm gonna say? What my answer to that is this, right? Here's the thing. What I've been seeing, right, is with all of the crime here in Philadelphia, it don't matter. Now, in the past, I would say yes, it mattered. The weather outside, the things going on, like when people are able to be out more, they do more. They do the most. And when it's cold outside, people are in. But no, these people doing, girl, they going hard.
I agree.
And it don't matter what time of year it is.
I definitely agree. I
Mm-hmm.
definitely agree. I definitely agree with you. It's different, and sometimes you're right. I do agree with you. You're right. People don't give a damn. It can be snowing or it can be 90 degrees. They gonna do what they gonna do. You're absolutely right.
Exactly. Exactly. It's like as much as we want to, sit them down, they won't sit down.
Exactly. That's true. That's true. So we got to just take notice of that and just enjoy this nice weather wherever we are. And
Mhm.
again, this is Mental Health Minute. So everyone that's tuning in, thank you so much for tuning in. Please don't forget to like and subscribe. And T,
Mhm.
what else do you have us? What else do you want to share with us right now before we get into the tea with tea time?
Girl, nothing. I just want everybody to have an awesome day and know what the day is. Know the reason for the season. We celebrating on Easter on Sunday, and just knowing what time it is,
Exactly.
and doing what you gotta do to live a proper life.
Okay. Yeah. Do you have Easter plans?
You know what? I don't. I don't.
Okay.
Normally I just go to church, so not
Okay.
just go to church, but church is always in our Easter plans.
Okay. Good.
Um It was like since COVID, Good Friday, we would always spend Good Friday in church. But since COVID, my particular church, I don't think it opened today. As far as I remember, I think my pastor said he was doing something different for today, and
Okay.
so that was one of the reasons, why I didn't go or whatever. So, but normally we'll go to service in the morning, and then it's over by 12 noon, and then go out to lunch or something, have our fish meal.
Wow, I love it.
So
Okay.
other than that, that's about it, girl. Let me tell you, I'm gonna be completely honest with all of y'all that's watching. I forgot it was Easter week. I looked up on Tuesday. Here I go. It's Easter this week.
Mm-hmm.
I don't have no outfit. No, normally I buy myself an outfit. I would buy myself something and buy my mom something. You know what I mean? Buy us Easter outfits. I don't have no outfit. I ain't get my nails done. I ain't get no pedicure. Like, I don't even look like I represent like it's Easter. Okay. I don't know
Mm-hmm.
what I'm doing. And I was sitting up there and I was just like, ooh. And then I was like looking at my schedule when you and I were talking today, and I'm like, sheesh, I do got a lot of free time on my hands.
So
I'm
you may
like,
have to run out,
I could
huh?
do something. And I'm just like, or I could just do what I'm doing and just sit in this house and just focus
Yeah.
on other projects that I'm working on. So,
Exactly. Exactly. For me, my plans is actually I don't have any. I don't have any. I know I'm going to go to spin class in the morning. So I got
okay.
to see what I'm doing for the weekend. I want to go to spin class in the morning and I want to go try to get my daughter to take me rock climbing. She's my activities partner.
Oh,
And hopefully we go skating or something. I love activities. If it's anything to moving the body or doing something, that's my partner. So I'm going to try to
I know
drag
that's
her.
right. It's always nice to have somebody that you can do fun things with.
Yes, and she's so fun. My baby's so fun. She grown, but she's fun, and she activities.
Mm-hmm.
She always come on, ma, and now she don't have to say come on, ma. I want to go. I want to rock climb. I know, right there. She is sweet. I want to
Yeah,
rock climb
she's
and go
awesome.
skating.
Mhm.
Isn't she? She is. I
Awesome.
know. She expensive. She grown, y'all. But she's so sweet, and she get her mama out the house. She come on, ma, and now I want to do all these things. Yeah, and that's my partner.
Hmm.
Yeah, when she get married, I'm gonna lose my partner, y'all.
No, you're not. You're gonna gain another partner.
Yeah, hopefully her husband will be fine. So I'll be like, girl, get your husband so we can go.
You're
you
gonna have a
know,
whole nother partner.
okay, when these young folks start dating and doing their thing, well, she dates and do her thing, but when she get married, I mean,
Yes.
she gonna be like, well, I'm doing this for my husband. I'm a third wheel because see, her daddy don't want to go. So
Mhm.
yeah,
What you say? I'm
that
on the way. I'm going. What you say? I'm here. Let's roll.
I'm going. Exactly. So I'm gonna lose my partner, so I'm gonna get her now. So yeah, so
Uh,
that's what I'm doing. I want to do something fun and have her take me somewhere. Yeah,
mhm.
have her take me somewhere. So that's what I'm doing. So with that being said, T, I'm ready when you are. Are you ready to give us the tea with Dr. Tyra?
Yes. All right. So now for some tea. Oh my goodness. So this week, I want to say this week was somewhat quiet, but I feel like it kind of wasn't. And so one thing that I saw that I thought was interesting on the Ricky Smiley morning show page, he posed a question to people this week, right? And the question he posed is, it's okay to cut toxic members out of your life because blood ain't thicker than peace of mind. And when
Right.
I girl. And all I could say was, oh my goodness. I said, I said, this is a question that people have been toying with for ages, whether or not to cut toxic people out of their lives, right? But you have to maintain your own peace of mind. He was right, he was dead on when he made that statement. So for him to, make this, comment, it had to be something going on. You know what I mean? That he wanted to share with people to let them know, it's okay to choose you and not choose toxicity, because I think we go so hard choosing things that don't matter that, yeah, now it's time to start choosing what matters. But that's a whole nother topic and a whole nother subject, right?
Yeah,
And
yeah.
so let me see this other. So this other topic that I saw, y'all know I got to come with something funny, right? I seen a post in regards to male lingerie as a side hustle.
Okay, when you showed that to me, I'm a little confused. Is it that the male that he's wearing the lingerie?
Yeah.
I see that that's not gonna sit right with me. So yeah, I'm judging, and this is my opinion. I like a man's man. If a man come in with some lace, please go outside. That's not what I want. I don't want that. I don't want that. We friends, because I don't want that.
Right.
No, no, that's not gonna work for me. What you think, T? You
I'm not feeling that. I want a man's man. If he got on lace, he better keep it moving. Ain't nobody trying to see all that.
I know.
Ain't nobody trying to see all that. Because I'm
Yeah.
sure whatever it is going to look a mess.
So it's a side. So when I saw the word side hustle, I took it T as is he selling it to us?
No, I guess women are selling it. People are out here now. That's the new side hustle.
Oh
Is
yeah.
selling lingerie. But how do you feel about, because this they saying this is a whole untapped area.
I get what to each his own and do your thing and live out loud and be unapologetically you. I get all of that, but I'm speaking for myself. I don't want a man wearing lingerie. I'm very old school and stay in your lane.
But would you sell it to him?
No, sell it to him so he can take it to
No,
his woman.
no, sell it to someone else.
I, will I sell it to another man to wear?
Yeah, sell it to
No,
the people.
no,
Like
I
you have a
want
store and have it
nothing.
up and selling it.
Yeah, I want nothing to do with that. Me personally, no, I won't even sell men's lingerie.
Okay.
Men boxers. Hey, if that's what I wanted to do, but I ain't into that. I can't sell nothing. I
Mhm.
don't. I'm so matter of fact. You want this or not? That's how I sell stuff. Who
Right.
does that? I can't sell anything. However, I know men's lingerie. It don't sit right with me, but to each his own.
Hmm.
Yeah.
Yeah. I mean, for me, I'm not gonna say never because I
Okay.
know, doing redoing some retail, you know what I mean? Anything is possible. And if I see is a good margin, and I can see a good bottom line total, then maybe.
Okay.
Maybe. I don't have to look at you in it,
Yeah.
but I'm
Yeah.
gonna keep my coins.
Yeah, I just don't want to be bothered with it because and then I'm not a salesman. I
Mhm.
literally cannot sell a life jacket to somebody drowning. This is me. Here's the jacket you wanted because you getting ready to drown. I don't know. I mean,
She said, "You wanted somebody about to."
yeah, like you can pay me when you get out the water. You want this? See, I don't know how to sell.
No, when it comes to certain, you know what? When it comes to something that you're passionate about, you know how to sell. D says, when my hubby was alive, when I went to bed, he called me Alice the Goon. That was when I was dressed up. Okay, not when you dressed up.
Yeah, see, I don't know. That's just me. That's my opinion. I just prefer I look a certain way and he
Right,
looked like he looked. Yeah.
right,
But to each his own and I hope
right.
it is a good market for them. Get your coins, do whatever y'all need to do. You
Yep,
know,
get your coins all
absolutely.
day.
Absolutely.
And
And
my
about your Ricky Smiley, let me just digress for a minute,
yeah,
T, about your
go
Ricky
ahead, girl.
Smiley, about the Ricky Smiley thing that you just brought up.
Mhm.
I agree. Because see, we was well, I don't know, I'm not gonna say we, but most of us was raised stick with your, blood sticking in water. Take
Right.
care with your brother and sister. Y'all stick together. That's your cousin and them.
Right.
Y'all together. So we
Mhm.
was raised with we're family. We're family. So a lot of us was raised with what family do to you. It's okay. They still family. You
Right.
can be mad for a minute, but
Mhm.
that's family. Go on, let them come over. We getting together for Thanksgiving. See, that causes stress and anxiety, and you
Heck
keep
yeah.
that toxicity in the family and in the household and in your life.
Mhm.
So blood, I don't care if we are blood. If
Right.
it's toxic and it's costing you your mental health, that's too damn expensive, and you got to get rid of that.
Exactly.
And you
It's
can
okay to say
help
bye
people.
bye.
That's right. That's right. And you can shelf people. You don't necessarily have to just remove them. You can
Mhm.
just go get yourself together mentally.
Mhm.
So when you get yourself together mentally and emotionally,
Mhm.
prepare to know how to deal with the toxicity if
Right.
you choose to keep them in your life.
Right. Yep.
Yeah.
I
What?
agree. I totally agree. I totally agree. Now the next story is about the professional baby namer. So it's a woman out of New York, Taylor Humphrey. She decided to become the founder of What's in a Baby Name. And she has a baby naming consultancy firm. She named 100 babies in 2020 and earned more than $150,000 a couple. Her services start at 1,500 for bespoke list of options based on parents' answers to a questionnaire, but can go up to 10,000 depending on the job. Now we've been naming babies for years. Like, you know what I mean? Like, who would have thought that this would have been a certain service? So like my thing is, so I'm gonna do some more research on her company, right? Because that's what I do. Like, are you going up in the hospital and looking at this baby first? And let me see what this little baby look like. Okay. I need to see what you look like and see if you look like your name. Okay. Because people be naming their kids and the kids don't look like what the names are. You know what I mean? And then sometimes kids is like, "Oh my goodness, I need to change my name." I had someone say to me, had a client say to me one day, "I am so glad to have the name that I have because no one knows who I am. They don't know if I'm black, they don't know if I'm white." And so with having a name like this is very important, and you think about it, yeah, and then you have to say what's in a name. What's in a name?
Absolutely. I love it.
What do you think about
This
that,
is a
Dr.
great
Candace?
topic. This is a very good topic, Dr. Tyra. I'm glad that you brought this up. Um, However, it's a two-parter for me. So here I go. Y'all know I'm coming.
Hmm.
We're paying her that much. I'm not knocking her hustle. Go and get your hustle, but that can never be Candace. I ain't about to pay you name my brats. That's for free. I got 4 kids. I ain't doing that. But some people may need help, and I get that. I ain't gonna knock her hustle. Do what you need to do. If it's a market for it, girl, you do that. But it will never be me. Okay? But I get that. Another one is it is something in the name. It really is because this how society is made up. And Dr. T, you know this, and the audience as well. When you're going out for certain jobs and certain positions,
Hmm.
I ain't never seen which it probably is, and not saying that it cannot be. I ain't
Hmm.
never seen a judge named Alizé.
You know what?
I'm just saying.
I haven't either.
I'm
I
just saying.
haven't seen one
And
named Shaquan either.
right? And I've been to court several times, and I ain't never seen that. And not saying that it can't be, so I don't want the people to come for me. Don't come for me because this real talk. I'm a realist. I just
Mhm.
ain't never seen that. Not saying that it cannot be. So I'm putting it out there. If there's a judge named Alizé, girl, high five and come on over to Mental Health Minute. We want to talk to you because
Yeah,
that's beautiful.
we want to know what kind of issues you had growing up and entering into this field, because we
Yes,
know
yes,
certain fields that you work in, you will have issues,
exactly. I
and they can
come.
lie and say they don't, but we know it's facts.
Exactly. I come from corporate America, and I used to work for San Diego County. And when people send their resumes in over the facts, they throw it away to Shaniqua's. I go get them out the garbage because she's a sister and she needs a job. But
Right,
when they can't say the name and
it's
it's spelled,
gone. File 13.
yeah, so it is something in a name.
Yes.
Can do I believe that people should hold the standards? to the names, such as you have some people named Angel, some people named Jesus, some women named Princess, some men named King. Girl, all them probably end up in jail. I don't know.
You know what?
I'm just saying. So sometimes people don't hold up to the name. You know what I'm saying? You the name your
Right.
baby King, and he ain't even paying his child support, and he run out here running amok, and his name King. I'm just saying.
I look, you know what? And it's you're telling the truth though. You're telling the truth because the thing is like when you look at people, I think some people name their children based off of things that they want
Yes.
instead of my thing is try to be, you know, how can I put it without being rude? Just be mindful when naming your kids. That's all I
Yes,
can say. Be
I
mindful.
agree.
Be
I
mindful when
agree.
naming your kids. You
I
know, I
agree.
get people naming their kids, and some of the things is just like, I can't.
I,
Like some of the names,
yeah.
you can't be my doctor lawyer with them damn hood.
I love it.
Thank you
But
for
I
that
will
one,
say this though.
Rochelle.
I will say this. Gossip and Heifers, I love Rocky. I will say this.
What
If
she said,
if I did a criminal crime, you
uh-huh,
know, and I'm not a criminal, but I'm saying if it's back
right.
in the day or whatever, and I did a criminal crime
Hmm.
and I'm trying to get out of jail, and Hakeem walk in or Tyrone, I think I kind of want him. I'm gonna feel my mental state back then to feel he feel where I'm coming from. Get me up out this Tyrone. You
Right,
know, I,
right, right.
yeah, I don't know. So yeah, I
Certain
get it.
individuals for certain things.
Yeah, there you go. Actually, I like my name. I do. Do you like your name?
I like my name.
I love my name.
Well,
I
it's
know
a
what
whole story behind my name.
yes, and I know what mine stand for.
Hmm.
Candace spelled this way, ACE, because there's certain ways you can spell
Hmm.
Candace. But
Hmm.
Candace spelled this way is when you become the queen of Ethiopia, she's automatically Candace.
Mm.
Come on now. I'm like,
All
okay.
right now.
So I do love my name, and
Hmm.
but my name, Elaine is my middle name.
Hmm.
Walters is my last name. So when I just put Dr. Candace Walters,
Hmm.
the statement that you made about your client earlier, I get that too. They don't know until they see
Hmm.
you. And I
Right.
was told on several occasions, "Oh, I didn't know you was black," because it's Candace Walters. And
Mm.
if you Google Dr. Candace Walters, it's a dentist, a judge, and a whole bunch of other white women
Mhm.
come up. Yeah, and then me. Yes,
Nothing wrong with
absolutely.
that. But my name years ago meant God of the Sun, right? But then as times went on, I see that my name from other dialects means different things. So another meaning of my name is God of battle. Which that, I guess for everything that I do, when I look at all of the things that I
Yes,
do, I help people through discover themselves through battles.
you
I
do.
help them figure themselves out. But my name has a whole other story behind it, right? My
Let's
cousin
hear.
named me. My cousin actually named me. My cousin didn't think she was going to have children, so she named me. She ended up having two kids later on, of course. But one of her first cases when she worked for the state, um a parent came up there. The woman was denied services from the state. She was denied welfare, and she threw this baby on my cousin's desk and was just like, how am I supposed to take care of her? You take her. And my cousin like, sis, you crazy. I ain't taking that baby. I don't even want none of my own. Like, and so she said, but the baby was the prettiest little baby she had ever seen. Her name was Tyra Shanae. And when she seen her name, she said, "Oh, when I have a daughter, I'm going to name my daughter Tyra Shanae." And so, few months down the road, my mom had me. And so, when she was in the hospital, she was trying to decide of a name. And so, my father came up with Charmaine because his name was Charles. And so, he wanted a Charmaine. And then he was like, no, her name could be Gail after his favorite cousin. My mom was like, I don't like Gail and I don't like Charmaine. That ain't happening. And so my cousin came in, and so she still didn't have a name. So my cousin came in, and she said, I got a name for you. She said, Tyra Shanae. And my mom was like, all right, I'll take it.
I love it.
And
And
that's
it's
how I got my name. Well,
beautiful.
it did look, and then they named me, right? So it's so funny because the woman, her name is Helen, rest in peace. She passed away with COVID this past year, last year, and she girl, my birth certificate. They went out having a good time.
I can
She went
imagine.
to go do my birth certificate, and she worked in the birth certificate department at the hospital at the time. Why the hell she spelled my middle name wrong, Candace?
Really?
Ask me when I got my middle name straight on my birth certificate.
When you was grown? When you
Girl,
got grown?
yes, the state refused to change my name.
Oh wow. So
She
how
spelled it
did
wrong. She said, and so when I said there, I said, "You did my birth certificate?" She said, "Yeah, I did your birth certificate." I said, "Well, my name ain't Tyra Sheena." I said, "Who's Sheena?" She said, "I don't know who that bitch is." She said, I said, "Well, you want to change my name back?" And she said, you got to figure that out, figure out how they go through. I said, "Well, they not changing it, like they're not doing it." And so she had since been left working there or whatever. But it was a whole situation. Girl, it was hilarious. But needless to say, I didn't get it changed till like 1995, 96
Oh, yeah, you were
from
grown.
72.
I know, right? I love it. You were grown. I
So
love it.
yeah, so there goes the tea. And y'all got a little bit of backstory on my crazy name.
Absolutely. I love it. And it's beautiful. And when you're in your name, you can't tell either. If it's just Tyra Gardner and we don't see you, you like, so who is this? We don't know. Black, white,
Mhm.
we don't know. Yeah.
You know what? My name was always more with black folks than white folks, even though there was one white Tyra that I knew of.
Because I know some white Tyras and they spell
You
it
do?
and they
I
spell
don't. I only knew the one actress.
and they spell it like that. And I got this common name. It's common, but I like it.
Hmm.
I like it. Everybody got a Candace in their family.
Do I? I don't.
But everybody know a Candace and they be like, she crazy.
Now
Everybody
they go, "Oh, Candace is crazy." No, Candace
I,
ain't crazy.
I know, and I'm like, no, we're not.
Yeah, that
But
is
I
too
love
funny.
it.
That
I
is too
do.
funny. All
I
right, so I'm going to go ahead and put our ad up. Put an ad up for us. All right, ladies and
yeah.
gentlemen, we're going to head right into our topic of the day, y'all. Our topic of the day. Dr. Candace knows she got this one, y'all, because Miss Tyra, she thinks she might know some stuff, but I'm trying to get it together. All right, so today's topic is sexual disorders. All
Yeah.
right. So we know people suffer from a lot of things, and we know, when it comes to sex, a lot of people don't realize the connection that the mental and the physical have, that actually facilitates the disorders coming on, and so Dr. Candace, oh my goodness, she's well versed in both areas because she got the mental, the psychological piece as well as the medical piece, y'all. Because
Yes.
my girl in medicine, y'all.
Yes, I'm trying. I really am. All praises due. I am trying. Hey, everybody. Welcome, welcome, welcome to the Mental Health Minute. And I'm going to digress for a minute. D, your name is absolutely beautiful. I thought you was a sister with that name, Denise Rita. I love it.
I know that's right.
Denise Rita Bernadette. I love it. I love your
Never would have
name.
known.
Hey, Denise. I love it. I love it. I love it. But yes, so today we are talking about sexual disorders. Now, I will say this. With sexual disorders, they have so many, so many. Let me get my book. Y'all gonna see me twisting and turning because I've got all these computers. But in this book right here, which myself, Dr. Tyra, and every therapist, every psychologist, every psychiatrist, have this. This is our Bible.
Mm-hmm.
However, you got several different sexual disorders in there. However, that is the psychological component. So we're going to get into a little piece and different sexual disorders and different types. We're going to talk about them. We're going to talk about the causes, where they come from, and different things that we can do to manage. So the first one is hyposexual desire disorder, not hyper, but hypo. Okay, HYPO, hypoactive. That means chronic lack. It means lack of interest in sexual activity. And for the reason, there are several reasons why men and women, so let me tell you, men and women can have that. So not just women. However, statistics have shown there is more women that have that disorder, hypo, than men. So, and which I definitely believe that because I have seen that as well. Working at the clinic, you have more women that battle with hyperactive disorder. And again, that is lack of interest in sexual activity. Now, can you have the desire with hypoactive? Yes, you can have the feeling, the desire. However, the interest it lacks, it's minimal. And there are several reasons. It could be psychological, and that goes back to the book that I put up, such as our DSM-5, where you would come speak to myself or someone like Dr. Tyra and other therapists or mental health professional to figure out what's going on and what can cause it. When you come to someone like us, would be maybe we will see if it's stress, it can be anxiety, it could be trauma, and it can be delayed trauma. I'm basically I'm asking and answering my own questions. If a person has this now, but was once very active, but start to lose interest. So are you? So basically, you're saying, oh, well, so can I get this years later? And it doesn't have to be physical; it's mental, absolutely, because you can have delayed grief, delayed trauma, stress. It can be anything like that. It can be a psychological component that's something wrong. It could be where your levels are off. Now, if you go see your primary care and they run tests with this disorder, there are tests that you can run. There are some disorders that you don't have to run any tests, but with this, you we can run tests where it can be a hormone, where your hormone levels are off. It could be something that is going on with you physically. It could be anything from genitalia, where it's something that's going on in that area, or it can also be something going on with your heart. It could be something going on with your kidneys. It could be something within the central nervous system. And the number one that it can be with when it comes to that, it can be, like I said, with your heart and your kidneys and things like that. But it can also be the foods we eat. Did y'all know that? I know, right? The foods we eat. It can come from that. Yes. So did you have any questions or the audience have any questions about hypo? So Eve said it's hyper for me. Yes. Hyper means active, like hyper, full going. Always have the desire. Hypo is lack of. So any
Mm-hmm.
questions about hypo
What
active?
type of foods? What type of foods do you think will cause a person to be more hypo, and foods that will cause a person to be more hyper
Okay.
sexual?
Okay.
Because I
So
mean,
for
we
the
always
food,
hear different things, like we know that there are different foods that people eat that, will cause issues with certain things. Like we know red dye number nine, that's always the
yes.
number one thing that causes issues. We know that the gelatins that's like in what is that? Gelatins that's in like jello and fruit roll-ups and fruit snacks and stuff like that. We know they cause issues as well. But and I know there are foods where people, like to eat like aphrodisiacs, right? When you look at the aphrodisiac type foods like conch, for example, in the seafood family, where people will go to that, to get their to boost their libido so that they can go ahead and do what they do. But what food groups or types of foods cause problems for that?
Okay, you're absolutely right. Red dye, processed foods, anything in the box in the frozen now. It's not for everyone. So I want the audience to be mindful of this. Not everyone will be affected by this, but this is something that we have done a study on. So processed foods can cause this as well. Lots of red meat. Again, not for everyone, but lots of red meat. Too much of it can cause it. Also, it's a medication, different medications, a lot of sugar, a lot of sugar, too much sugar, processed foods, lots of red meats, and a lot of gluten. A lot of us cannot take gluten. Now, gluten is not bad. I know people have thought that, so let me just digress for a minute because I'm going to bring it all back full circle. Gluten it makes you full, and it's in bread and wheat and pasta and all these things. And we can, as human beings, everyone, digest glutens. However, we have a certain lining or certain, yeah, in our stomachs that some of us, that lining, when the gluten hit it, it doesn't dissolve and it doesn't break up. Imagine it, because all our food is supposed to break up and go to where it's supposed to go. Small intestine, big intestines, and go away, and then the nutrients. Some of us in our stomach cannot handle that. And once it hit a certain lining of the stomach go into shock and say, what is that? And we get bloating from that. We bloat, our sexual desire decrease. Okay, we get bloating, sexual desire decrease. We break out. It's a whole allergic reaction to gluten, and that can be one of them as well. And we have done a study on this. So gluten. So those are some of the things, and also certain medications that we are prescribed, and also certain over-the-counter medications can interact with that. Please be advised of that, especially sinus medication. Did you know that? And this is sinus season, especially here in sunny California. I just
Girl, I
wouldn't
did not know that. I did not know that.
we did a study on that, and where you can say, you know what, I was fine, and now I'm feeling a way. I'm feeling a certain way, and y'all, you took with some Claritin, but it didn't. It's not resonating. It's not. It gets in your central nervous system, and it tacks on because we do have something. Yes, meds, exactly, Eve. We do have something in our body that, with our in our brain, and it's a. I can actually show it to you. I wish I could. Right up in here, and with our, that's where our sexual stimuli come from. And that medication will go straight to that, and we like, I want it less or I want it more. Certain medications, it's basically more. 9 times out of 10, when it hits that area, it's less. You want it less. So those are certain things that we can do it. Now, for the foods that will help, will be chocolate, dark chocolate. And it's a certain percentage in chocolate, 70 on above. Good chocolate. I ain't talking about no M&Ms, y'all. I'm saying that good chocolate. Yes, the good chocolate, the dark chocolate. Blueberries. Blueberries have antioxidants in it. I know people say, well, coffee has antioxidants as well. Not all coffees, some coffees. So some coffees will help and some will not. And when we talk about erectile dysfunction, we will get into that. So some coffees, but dark chocolate, absolutely natural healing. So I hope I answered your questions. But blueberries, dark chocolate, bananas will help it have the potassium, and potassium helps with sexual drive. Did y'all know that? Yeah.
Sure did not know. I sure didn't know about the bananas, because
Yes.
I was thinking. But bananas also help for anxiety.
Yes.
And that's
And
the
sexual
piece that
drive.
everybody don't know. You get yourself up when you start feeling anxious, get yourself a banana. And that, starts to
Absolutely.
bring your levels down. Also, bananas help for when you get a charley horse in your leg.
Yes. Yes.
So bananas have a
Oysters.
lot of good things that it helps for.
Yes.
We had a
Absolutely.
couple of comments.
Another one is oysters,
Mhm.
watermelon, walnuts, and fish, but fish like salmon and different stuff and green veggies. So what was the comments?
Okay, so the first comment was um Rochelle was saying her sex drive has really gone down since having a surgery, a partial hysterectomy. You know
That
anything
can
about? That can
Yes,
happen.
that can
Okay.
happen. Absolutely, that can happen. My recommendation is go to your primary care and let them know what's going on. And after they run some tests, because it could be hormonal, because once a woman gets a hysterectomy, our hormones fluctuate.
Right.
Some leave and some stay. And like, where we gonna be? Where we going? Where we going? What we doing? So I
Mm-hmm.
hope y'all with me. So I'm painting this picture for you. Imagine me floating around, and then something is taken away. So I'm
Mm-hmm.
looking at the rest of the hormones, and I'm like, so where I need to be? Because where I was once placed, it's not there anymore. So
Right.
where I need to be. So they could either give you a hormone replacement. Some are good, some
Mm-hmm.
but you advocate for yourself and do your research and talk to your primary care so they can give you a hormone replacement, or if they check after checking all your numbers and everything is good and is not hormonal, it could be psychological, where sometimes, and I have talked to several women that has battled with this. You
Mm-hmm.
notice I didn't use the word suffer, I said battle, that has battled with having a hysterectomy, and now they are feeling a certain way because they're like, I kind of lost what I had, that, and they feel mentally that has affected what's going on down there, and
Right.
they're walking on eggshells in their sexual life because they're like, will I still have an orgasm, can I?
Mm-hmm.
And so there's certain things you can do. Talk therapy. If it's psychological, there is treatment. And also check with your primary care, let them run tests because it can be hormonal. Is there treatment? Absolutely. Absolutely. So I hope I answered your question with that one.
Well, thanks for that answer, Dr. Candace. Here's our next question from Granny Wowzers, which is, how do we change from hypo when you have been celibate?
Oh, okay. So I want to make sure, let me read the question. How do you change from? So are you saying you're hypo and you have been celibate, so you would like to be hyper? Am I reading that correctly?
Yeah, I guess she's been hypo, and she wants to
Okay.
change from being hypo to hyper, but it's kind of hard when you've been celibate for so long.
Okay. Got it.
Um,
Okay. So
Granny
this is
Wowzers,
how
if you pull over, let us know.
Okay. So this is what my opinion and my suggestion for that. If you have the desire, that's all you need. All you need is the desire. I don't recommend anyone to say, I want to be hyper, and because it shoots up here and your sexual peak. And what if your partner peak is not there? Then it may be a mental or a physical struggle or issue. So if you have the desire, let it be, let it ride. You want it to be natural. If your body go into hyper, that is fine as well. We can work on that. But if you're hypo but have the desire, hey, one day a week or one time a month, as long as you are satisfied and have the desire. Does that make sense? So I hope I answered the question. You don't want to, quote, I'm putting up quote signs, change. You want to, if you have the desire, let it be. Let it flow. I recommend that. And I'm pretty sure I can speak for my colleagues as well, would feel the same way, that we don't want you to go from one to another. You want that good balance. And all we want, especially at a certain stage in our life, is balance and to have the desire. We just want to have the desire. That's it. We just want to have the desire. Everything else can be treated. It can be treated. Sexual disorders, sexual different issues that may go on. I am here to tell you, all of them can be treated. They are. It's two things: physical or mental. We can handle and tackle both. It's okay. So if you have the desire, Granny, it's okay. You got this. You got this. You don't want to go over to the other if you don't have to. And if you slide over there, still slide over there with a smile on your face. You'll be happy, especially if your partner's sliding over there with you.
I know that's right.
Yeah.
Yep. Awesome. Yep. That was our two questions. Everybody in
Okay.
the comments is saying how they love learning about the dark chocolate and the blueberries, and knowing, and they were glad that they received the live and everything. Definitely share our live, ladies and gentlemen that's in the thread. Thank y'all so much for joining us. All right, Dr. Candace, go right on in.
Okay, and my next one is, and I'm looking down at my notes. I have several notes, people. My next
Mhm.
one is sexual aversion disorder, and that is persistent or a recurring phobia. where you are avoiding sex. You are avoiding sexual contact with your partner. And I am very familiar with this because I've had some patients that has had this. It's called sexual aversion, where they have limited to no desire. However, they are avoiding it. And a lot of times it can come, and I'm going to revert back. So with sexual, you're going to revert back to two things: mental and physical. And it could be from, but what I have saw in my career, trauma, a lot of trauma, a lot of trauma from that where you are avoiding. And I'm going to say, but that's not the number one. That is not the number one, people. Let me tell you the number one. And you may be shocked, and then some of you may not be, because this is an amazing audience. Trust. Trust. We did a study on that as well. Trust, especially because see, when you come to anywhere you go, any medical facility you go, we always do blind studies. We do what they came in for, how we gonna treat this, and what was the reason. The number one reason people will think it would be maybe medication or sick or trauma. No, it is trust when it comes to avoiding. When you are avoiding, we always want to say, oh, they're avoiding sex. So did something happen? Wouldn't that kind of be the go-to, Dr. T, for you? If someone say, well, I've been avoiding sex and I don't want to have it, the first thing I will go to, especially being a therapist, is trauma. Did something happen?
Right.
You know,
Right.
was
However,
there,
I did have one person, somebody that I know, they didn't have no trauma.
oh,
They
was
just
it
don't, they just don't like it.
okay? And that's normal. That's
And I'm
okay.
like, I know you lying. That's what I had to say. I had to use your line. I know you lied about that.
But that's okay. They asexual. A lot of people are asexual. A lot of people have converted over to being asexual. And I'm going to digress for a minute because we're talking about sexual aversion disorder that kind of can go with asexual as well, because an asexual means no desire. And is that okay? Absolutely. Absolutely. This is a mental health minute. Absolutely. It's okay not to have the desire. Is there anything wrong with those people? Not at all. Not at all. Are they still have attraction towards their partner and towards others? Yes. Some of them are maybe just sapiosexual. I am sapiosexual. That means it's mental for me. It's mental. Everything's mental for me. If you rub my arm, if I'm mentally stimulated, I'm happy. But if you a dummy and we can't hold a conversation, please don't touch me. Draz, the Sahara Desert. I'm not doing this. So I'm a sapiosexual. It has to have that intellectual connection. And with asexual, they can have connections with you, but they don't need the other. And that's okay. It is okay. No one should have shame or guilt for that. So with the aversion disorder, the number one is trust. And a lot of that stems from childhood because sometimes our innocence, some people innocence has been taken away from them, so they grow up with that and they avoid. Does that make sense? Even though they get with a partner and they can become happy, they could have a delayed. We all have a switch where there is a delay, and now all of a sudden they're 30, 40, and 50, and they're like, they're avoiding it, and they don't know why. I've had people come into the office and they're like, Dr. C, for some reason now I have no desire and I'm running from him. I'm avoiding everything. Everything else is good, but when it comes to sex, I avoid that, and I understand. So it can come from different things. It can be physical, but mental. And for the mental, the number one is trust. Number two, it could be trauma. That is psychological. For the physical, it could be something hormonal or it could be pain. A lot of times women can have painful intercourse and now they running from you. They running from the partner because it's pain and they don't know how, or they're not comfortable or they have shame and they don't know how to sit down and have that communication to say, babe, it's not you per se, but it's hurting now. It's painful when we have intercourse. And a lot of women don't want to have that conversation, which I totally understand, or don't know how to have that conversation. Yes. So any questions about that? Any comments?
Granny Wowzer says everything is mental for me as well. I cannot get in the mood without that mental stimulation. You
Right
know,
now, Granny Walls.
that's right.
I'm
Right.
the same.
I'm the same also, and it's just like it's funny because when you think about, sexual disorders, you don't, a lot of people wouldn't think about sexual aversion. disorder, and people just not wanting to, do, to have sex with, just they don't, number one, they don't want to just have it with anybody, but at the same
Mhm.
time, they wouldn't even consider this as a disorder. You
And
know
it
what
is
I mean? They just think that the person is just totally avoiding them because they're not into them. And it's not to say that the person is not into them. You could be into somebody, you're just not into them sexually.
absolutely. That's it. I love it. That was beautifully said. Thank you, Dr. Tyra. Absolutely, she's absolutely correct. And like I said, where that comes from, can it be treated? Absolutely. However, I want to put this out there, ladies and gentlemen, to the audience. Treatment requires one major thing: you have to want to be treated.
Say
You
that
have,
loud.
especially with sexual disorders, you can't. It ain't like you have a cold and you take NyQuil, go to sleep, wake up, and you like, oh, I'm good, I can go to work. Mm-mm. You have to want to. Medication, different things won't just work when sexual disorders. When you're not, that's not what I want. It takes mental, it takes strength, it takes all of you. It takes you. You have to want to. It's not like other things. You have to want to. So that's with sexual aversion. The next one is sexual arousal disorder. And I'm pretty sure all of us have been here, know somebody that was here, been with a man that was here, just everything. Know this. This is what that means: persistent or recurrent inability to attain or maintain sexual excitement. And with that being said, is that it's two ways. You can become excited by touching or kissing or some type of foreplay, and then it just go. When it's time to get busy, it just all goes down. A lot of times that happens. It happens more for men than women, and it's not erectile dysfunction. It's here. A lot of times when well, again, when you go to the doctor and you explain these things, we all doing blind studies because we need to know how to treat it for the whole when other people come in as well. So with this one, it happens more with men than women. And with this one, it's not like erectile dysfunction. It is more mental. And then it affects his little guy. Y'all get what I'm saying? I'll explain it again. I try to explain as simple as possible so everybody can get it. We all can get it, even myself. When a man is battling with sexual arousal disorder, he can get it to where it needs to be. So it's standing at attention and y'all touching, y'all talking, and men are more visual than women. So he's looking at you and it's good. And then something is on his mind, whether it be stress, anxiety, trauma, whatever's going on, and he didn't lost like, yeah, and that's okay. Is that okay? Absolutely. Is it treatable? Yes. With talk therapy, and also there's medication for that. The medication is more mild than with sexual arousal than it is with erectile dysfunction. We'll get into that. So, any questions about that one? So, what do you know, or what is your knowledge or anything, Dr. T, that you have on arousal? What would you like to bring on arousal, especially for the women?
One thing I will say is, with sexual arousal, disorders and things like that, alcohol and drugs play a role too. If you're using them, or if the individual that you're with is using them, you definitely, they do, can affect how things happen, in regards to whether the person is actually, stimulated by it, sexually stimulated by it. And sometimes people think that, oh, it's me, it's me, it's me, they couldn't, perform because of me. But if alcohol and drugs is involved in it, that might not necessarily be the case. It don't necessarily have to be you. You know what I mean? It's just that you just got to look at, the whole picture, of what was going on, and certain foods can cause that too, you know,
Absolutely.
to make you lose your, lose focus and lose, the arousal, so.
Absolutely. Well said, absolutely. And another one for arousal, for sexual arousal disorder, is the person that is battling with that. A lot of times they have to visually see, smell, or touch, or be touched a certain way. So there's certain things that helps them with that. Movies. I have had some clients that cannot actually perform unless they visually see something. Maybe it's a movie, like a pornographic movie, and then they're able to do the act because that's they get more aroused that way. Another one is a smell. certain perfumes, certain cologne. I have some women who's like, I love a good smelling man, and that gets me in the mood. So she's more aroused by that. Another one is a certain touch, being touched a certain way, arouse them. If they're not touched in that way or in that area, they're not aroused. So we have to keep that in mind as well. There's certain things that brings on the arousal, and there's certain things, as Dr. Tyra stated, that you won't get the arousal because of drugs and alcohol, even smoking cigarettes, even tobacco can, plays a part in that as well. So it's certain things, and medication. Yes. Did we have a comment?
Yes. Granny Wowzer says, my last partner, her son's father, had to watch porn as much as he could, had to have any form of sex as many times as he could. He could ejaculate multiple times. Every woman to him was on the plate. Mm.
Yeah.
Yeah.
And with that being said, I know, but I want to talk about it from a therapeutic and also a medical standpoint.
Mhm.
His is hyperactive.
Right. That's hyper.
Hyperactive.
Mhm.
Yes, his was very hyperactive. And it's something in the body. It's a hormone that we all have. It's a sexual hormone. Remember, I showed you where it is in the brain, but it's a sexual hormone we have. And his, on a scale of 1 to 10, his was a 10. Is there something where we can get it to a 2? Well, we don't want it to be a 2. We don't do the brother like that. How about it? Something we can get it at a 6 or a 7? Absolutely. There are different things he can take, and there are different things that he can actually do to get it to a 6 or a 7. But maybe he wanted at a 10. But there is something that needs to be adjusted, but it's up to him. Because again, with sexual, if it is not actually hurting anyone, so, and when I say hurting anyone, I want to be more clear because again, we're talking medical, such as pedophilia. That's hurting children. That's where you are given certain medications where you don't get an arousal, and we give you a medication that alters the brain. So when you see children, little boys, little girls, you don't have that desire. That goes back to the sexual arousal disorder. They are aroused by children. So they are given certain medication. So the little guy don't work and the brain don't work for that. I hope everyone is with me. I try to explain it as simple as possible to where they are given a certain medication to where they cannot function sexually nor mentally on that aspect. So if it's not hurting anyone, yes. So I hope I was clear on that. Then there's another one it's called it's non-coital. I can spell it for you. It is NONCOITAL. And that means when it's sexual arousal. Yes, sexual arousal. You have the desire, you want it mentally, you don't want penetration. Still can have an orgasm. Did you know that? Want it mentally, want the desire, you get aroused, no orgasm. Well, I'm sorry, you can have an orgasm, no penetration. Where the penetration comes from, where the orgasm comes from, anal or sexual? Or anal or oral?
Oral.
Yes, that is it. Any questions about that? Before we go to the main one. Well, all of them are main. All of them are good. I have several, but I don't want
Yeah.
we do a part 2. But I do want to touch on EDD. That's
Yeah.
erectile function disorder. Now,
Hmm.
with EDD, I have that is when a man cannot. He doesn't stay. Sometimes he could come to his peak and be erect, and sometimes he cannot. Or when he gets there, he doesn't stay there. It could be several things, and I have them written them down here. It could be mental and it can be physical. Physical means it can be medication. It could be something going on with his testosterone. It could be something going on with his heart. Ladies, did you know if something is going on with the man's heart, lungs, or kidney, it can affect the libido. It can affect him rising to the occasion. So he may need to see his primary care. It can also stem from stress. Yes, it can stem from stress, trauma, anxiety, smoking, alcohol, And these are certain things that we can do, that the gentleman can do to help himself with that. Did you know, if a man is overweight, that problem is greater than a man that is not, that is physically active. So losing weight, quit smoking. It can be the alcohol, like Tyra said. He can also talk therapy, and he can also get on a certain medication. I'm pretty sure every woman either know about this medication or heard about the medication. That cute little blue pill. Certain milligrams though. You don't want to have a high milligram because he can be erect for 4 hours. And now you looking at him like you gotta go. Yes, there are certain foods he can eat and different things. So any questions about that? Any questions? And with that, the main part with EDD
Mm-hmm.
is communication. If your partner is battling with EDD and you're the woman, address it kindly and with grace. Ask him what's going on. Tell him that, like, do your research,
Mm-hmm.
talk to him, and ask him what's going on. Because with EDD, shame and guilt come from that. A
Mm-hmm.
lot of men have shame where they like, oh, I'm not performing, because the ego is attached to that, especially with a man. The ego is attached to the sex. I want every woman on here to know that. The ego is attached to that. So you have to approach it gracefully. You can't approach it where like, oh, he can't perform. He this and that. This doesn't work. No, be kind. We don't want to do that. We don't want to do that to ourselves, and we don't want to do that to him. So what you do, you open up that line of communication and you say, well, babe, we can go get checked out together. Or what, was there something on your mind? And then some men don't properly look at their diet. Absolutely. Those are different things that you can take. The vitamin B and the vitamin 3 and 9, D, and zinc will help. But I definitely recommend going to your primary care so they can run certain tests, because it can be something wrong with the kidneys. You know, it all run together. It can be something wrong with the bladder, anything where he needs to be checked out. And it also can be something mental. But I just ask that communication should be the focal point. Please talk to him and allow them to open up to you. And if they don't want to talk to you, you recommend they talk to someone. That's what I think you should do. Any questions about that?
This was awesome. This was awesome, Dr. Candace. You gave
Yeah.
all the facts and everything when it comes to sexual disorders.
And
Hopefully
that's
you
just stuff.
educated a lot of people, about this, because the thing is is a lot of topics that people are afraid to discuss. And, we hear about everything else, but we never really hear much about people really going into depth about sexual disorders. And I know there's a lot of women on the platform and everything, and people have questions, and so I'm glad that we were able to address the issue and talk about some of the questions now, so people have a better understanding of things, when it comes to that. Now, one thing I learned about the vitamin zinc, that when males take zinc, I learned that it has a positive effect over their arousal and maintaining an erection.
Yes,
I did learn about that with the vitamin zinc. So now, ladies that's on here, don't be running out going to get that man all that zinc now.
I know, right?
Loading them up to the point where he about ready to bust.
I know, right?
Literally.
Be like, here, take this.
Mhm.
And him, he thinking it's candy. Here, chew this, chew on this, and go on over there.
Okay, yep, exactly, because they come in a gummy now. But
There
yeah,
you go.
yeah, this was awesome.
Absolutely. We definitely got to do a part two because I have so much information. We didn't even get into the orgasmic disorder. I have so many other disorders
Right.
that we can get into. So
So
I
we're
would
gonna definitely
definitely
make this
love.
a part. So we definitely gonna put this as make this a part two.
Yes,
We're gonna have to put that on the list for part two for sexual, because we didn't even handle impotence, and that's
yes,
another area that a lot of people have questions about
yes.
when it
I
comes to
have
sexual
lots of
disorder.
information on that. So we have to
Yes.
do a part two.
Yes.
This was amazing, and your questions and your feedback. I love that. I love that. I love that. So we will do a part two, but for right now, what do you have for us right now, Dr. T?
What I want to say is make sure that everyone, take your health seriously. When you have a partner, make sure you're able to sit down and talk to your partner about the issues that they're having, especially if it's, issues within the sexual nature, because sometimes men don't talk about some of their health issues. They become angry, they become depressed, sad, they just won't say anything about it. So keep the lines of communication open so that they know that you actually you are aware, you care, and that you will do anything in your possible power to make sure that they're feeling good and feeling healthy when it comes to the sexual health. Because at the end of the day, physical and mental are connected, and everybody needs to understand the connections. And that's what myself and Dr. Candace is doing, with our platform, making sure everybody knows how everything is aligned within our lives.
Absolutely. You are absolutely right. You are absolutely right. So this was amazing, amazing, amazing. And I am so glad that everyone tuned in. And I'm sorry, my dog is barking in the background. I hope y'all don't hear him. If you do, I do apologize for that. But this is the Mental Health Minute, and I am Dr. Candace Elaine.
I'm Dr. Tyra. Thank you all for joining us. Want you all to have an awesome day. Dr. Candace, did you want to do fun facts today, or you want to save that for next week? All right. So we want to thank you all for coming through and want you all to have a happy Easter. Have a good one, everybody.